Thank you, Harry. And yes, we do appreciate all of you adapting to this new technology and learning how to Zoom. And I think we're all going to be Zoom experts by the end of this pandemic. So I am going to talk about some big changes that have come to the community Medicaid. There haven't really been major changes to Medicaid in several years, but this is a big change that we want to talk about. So this change really came about before the pandemic. So before the pandemic, New York State was facing a budget deficit, as many of you know, especially because of Medicaid. So the legislature and the governor were looking at ways to cut money from the Medicaid budget. So Governor Cuomo appointed the Medicaid Redesign Team 2. And that's 2 because he did this several years ago and they came up with some cuts, basically implementing managed long-term care. That was a while ago. So now they reconvened and they came up with more Medicaid savings. The proposals that they put forward to cut Medicaid, they passed in the budget. But that was around April 2nd, April 3rd, right at the beginning of the pandemic. And because of the pandemic, New York State accepted federal emergency funding. And one of the conditions of receiving that funding was that there could be no cuts to Medicaid. So even though these cuts were passed in the legislature, they are not implemented now. They are meant to be implemented on October 1st. Now there is a possibility on October 1st that we can extend the cuts for 90 days if we receive more Medicaid funding. So the biggest cut is the change to community Medicaid. So as you know, or you don't know, community Medicaid is the program that lets you receive care in your home. And now the change is that there is going to be a 30-month look-back period for community Medicaid. So currently, there's no look-back period for community Medicaid. And as you've heard us speak on the radio or at our seminars, you could put all your money into a trust now, this month, and then next month you could apply for community Medicaid and be eligible. I think David says in his seminars that he could get Bill Gates eligible for Medicaid. So there's no look-back period. However, this is what the new change is going to be. Starting on October 1st, 30 months. That's a 2.5-year look-back period. So what that means is when you apply for Medicaid, they are going to ask for 2.5 years worth of financial statements. And they're going to look at all of those statements and see if you made any transfers of money. And they're going to then add up all of the transfers that you made, and they're going to calculate a penalty period. And in fact, this is handled the same way that nursing home applications are handled right now. And many of us are familiar with the nursing home look-back period, which is currently 5 years. So this is going to be calculated the same way. It's just a 2.5-year look-back, but any transfers that you can't explain, you know, gifts to your children, gifts to your grandchildren, those are going to be counted and you'll be penalized for them. And so they're going to calculate a penalty period. And they do this by taking the, they have a divisor that's out by region, and it's roughly $11,000 for the Albany region. So for basically every $11,000 of gifts that you made, you will have 1 month of penalty. So let's say now this is, you know, after October 1st and I apply and I had set up, and I had created a trust right after October 1st, and then I need to apply for community Medicaid. They're going to look at how much money I put in the trust or my house. A lot of people put their house in the trust. So if you put your house in the trust, it's going to be quite a large penalty period. You know, if it's $11,000 a month, you could have a 20-month penalty period, for example. So you have to wait that amount of time now before you can get community Medicaid. So this is a big change to the way we plan, because the way we plan now is we can do things last minute, get you qualified for Medicaid immediately. And so now we have to think in advance. So how to avoid the penalty period is just like we said, like we always say, think ahead of time, create the trust now. Even if you don't need Medicaid right now, you need to create the trust now to start the penalty period. If you're thinking of using this in the future. So that's number one, is to try and plan in advance. However, number two is what we call crisis planning, and it's the same for nursing home, and it's going to be the same for community Medicaid. And this is for people who haven't planned in advance, or they did make a trust, but they didn't make it through the penalty period. There are definitely last-minute solutions that we can do for you. So one solution that we use right now is a gift and a promissory note. And that's basically where we can transfer half of the money and save half of the money. And I won't go into big detail about all of these solutions, but just to let you know that there are solutions out there that we can use. And there may even be more that we come up with as the elder law attorneys adapt to this new law. Another one is transfers to a spouse. So you can transfer money to a spouse, and that's an exempt transfer. And your community spouse can have more money than you can if you're applying for Medicaid. So if you're applying for Medicaid, you can only have about $15,000, but your spouse can have $74,000. So the good thing about this, the new Medicaid law, is that they didn't take that away. They were talking about taking away the spousal budgeting, which allows the spouse to keep more money. They were also talking about taking away spousal refusal, which is, let's say your spouse has more than the amount they're allowed to have, the $74,000. Your spouse can do a spousal refusal and say that they can't contribute to your care, even though they have the money to do so. And then that means you'll get Medicaid. So on the bright side, these two planning techniques are still available for you. So there is a lot of planning we can do with moving money between spouses. The last one is there are some exempt transfers. There's not a lot, but the caregiver child one comes up pretty frequently. So a caregiver child is if you had your child move into your house with you to take care of you, which is pretty common. And they've done that for at least 2 years. You can then transfer the house to the caregiver child without a penalty. You also have an ability, if you have a child, an adult child with a disability, that you can transfer money to them and not be penalized. So we are going to look at everything, all the tools we have available to us to try and help you out and see if any of these exemptions apply. And now I'm going to turn it over to Kim Hans. Many of you know her. She's our geriatric care manager. And she's going to talk about there's some changes in the eligibility determinations. That's not so much of a financial nature, but I'm going to let Kim talk about what those changes are.
Thank you. Good morning, everybody. So in addition to what Jane Marie was speaking about, the financial eligibility, of course, we're going to have some changes in the actual eligibility determinations from a physical standpoint and what you need. And they're going to be a little more challenging now than they were in the beginning. So again, starting October 1st, there's going to be a change where physical maneuvering is needed for more than 2 of your activities of daily living. And a lot of times we'll talk about like, what are the actual activities of daily living? And those are things like the bathing, dressing, toileting, ambulating, transferring, eating, those types of hands-on tasks. And we talk about physical maneuvering, we're really referring to how much hands-on care somebody needs in order to complete that task. So when you're talking about somebody bathing, it's not just somebody to be there to be safe. It's somebody that's actually physically assisting the person in the shower, physically washing the person, whether it's one body part or multiples. It's the physical assistance of helping someone out of the shower. So those are the things that we really have to pay attention to. The language is a little tricky too, because it says physical maneuvering with more than 2 of activities of daily living. So really effectively, an individual must need assistance with 3 of the activities of daily living. So that's half. So that's a big step, because a lot of times we can make a case for somebody needing assistance with bathing and maybe transferring. Now this is stepping it up and requiring assistance with 3 of these activities of daily living. When we're talking about somebody who has dementia or Alzheimer's, we're now talking about somebody needing assistance with 2 of the activities of daily living. And that's much more restrictive than it was previously required under the home care auspices. The only change that really could be seen as positive now is the inclusion of language saying that somebody needs at least supervision. And when we're referring to somebody with Alzheimer's and dementia, because under the Medicaid home care plans, one of the programs that we use, which is called Consumer Direct, it doesn't currently allow for supervision as a task. So when we're looking at using Consumer Directed as one of the options for our folks wanting home care, we have to really look at the difference between somebody who has a lot of physical need versus someone who really just requires something that we consider oversight and supervision. So big changes there, and some of the things that we really have to pay attention to, because we're more concerned now, not only from a financial perspective, but really from the actual task need or need of the individual, medical need of the individual. So the other big thing that's going to change are how the assessments are done. Currently, there's an organization called Maximus that's contracted by the Department of Health, and they go in and do something that's called a UAS, a Universal Assessment Screen. And under that UAS, you get a score. And based on your score, kind of qualifies you for needing long-term care. And the way they do the grid is you need long-term care for more than 120 days, so more than 4 months. That's what really qualifies you medically for needing long-term care services. So the new law imposes a requirement for independent assessments of those high need individuals. So currently under the UAS, you're supposed to score a 5 or higher in order to qualify for long-term care. We haven't been given a number yet, but it's essentially equating to those who need at least 12 hours of care a day, that they are going to need to have an additional assessment done. And really the concern is that the state or the Department of Health can determine that the individual really cannot remain safely in the home and will need to be institutionalized. We've spent many years in the last decade really changing the system so that folks can be at home and have services provided at the home. And now we're really looking at maybe there's going to be a change in that any individual who scores high on this risk assessment is going to be required to be institutionalized in order for Medicaid to pay for the care. So those are some things that we're really concerned about and we're paying attention to and watching. The other big thing that's going to happen is currently your own personal physician can fill out the medical paperwork that's necessary to deem whether or not you have a disability so that we can use the community pooled trust for your spend down. Under the new rule, the new law, the services are going to have to be done by a physician who is contracted by the Department of Health. So currently that means, it's a physician that doesn't know you, who's not aware of your circumstances. And so there's going to have to be a lot of advocacy on those of us who are providing services and for families to understand that in order for somebody to get that qualification, we're really going to have to be very clear about what an individual's needs are and not just how they're presenting at that day that they're going to be having the assessment done. We still believe that Maximus is going to be allowed to do the initial long-term care assessment. So currently that is a good system. It's a good assessment in order to qualify somebody for needing long-term care. So we are hoping that that is going to stay in place. Still a lot of unknowns to doing that. So talking about the actual assessments in general, individuals in managed long-term care currently are have to have their needs reassessed annually instead of every 6 months. When we're talking about the independent assessments, we're talking about personal care or the consumer direct services must be prescribed by an independent physician under contract with the Department of Health, like we talked about before. Previously, these services were really done by your own physician and your own care team, if you will. The change really raises concerns about eligibility because, again, that contract physician is really not going to know as much about you or the person that we're looking at. So we're very concerned that they're not going to be getting clear information about the individual. It's really the tool that they're talking about is supposed to identify how the individual can be met through other circumstances, not just an aid. So perhaps telehealth, maybe family, and there are other informal community supports that can step in. And while we have wonderful supports in our community, these supports are only meant to kind of bridge the gap for our folks that really require that one-on-one level of care. And again, talking about the Department of Health being allowed to make the decision as to whether somebody who qualifies for 12 hours of care or more, they're actually going to be able to make the decision whether or not that person would receive care at home or in an institution. So there are some real significant concerns that we have. We don't have complete language yet, so we're trying to vet through a lot of the 300-page document that was sent out to try to, make sense of it. So please stay tuned and let us guide you through this process because it is going to be very challenging in the upcoming months.
All right, thank you, Kim. So before I go on, let's just kind of recap what Kim was talking about, because that all sounds kind of scary, doesn't it? Sounds like there's a lot of changes that are coming through that are going to kind of push back on the community Medicaid. And that is that may be true. They are looking at ways to save money in the program, but overall, community Medicaid is cheaper. Keeping people in the community and at home is cheaper than institutionalization. So I have to believe that as these rules are implemented, as they have regulations come out, that there's going to be workarounds and that, maybe they're not going to be as harsh as they seem. Some of them aren't meant to take effect until two years from now. So there's a lot of work to be done before these are implemented. And a lot of this got delayed because of COVID. So there hasn't been a lot of discussion and input from the community on how these are going to be implemented. So, I'm still hopeful that it is going to be a strong program. Even we can work within these rules. It's not going to be, hopefully as drastic as it sounds, because the government's still going to look at where is it cheaper to take care of you and home. And that's really the place where most of you want to be. If you are here in person, I'd say how many people want to stay home? Raise your hand. And I would bet every one of you is raising your hand. All right, so just to review, I want everyone to remember that community Medicaid is the program that lets you stay in your home and receive care. And we are lucky in New York. I know New York is facing budget cuts and all that, but we do have a pretty robust home care program. If you look at other states, their home care programs are not as good as New York. So even with the cuts that are coming in New York, it's still a better program. In fact, many of you who go to Florida for the winter, right? If you are looking at getting home care in Florida, the program down there is not as generous, and many people come back to New York to access the home care program. So to go on with the review, if you want to apply for community Medicaid, you need to protect your assets by putting them in a trust. And the key thing to remember is do that in advance. So both for the new rule, just in general, that's good advice to do this while you're healthy, to get this done ahead of time. But in particular, because of the new rule, you need to get this done before October 1st, before that new look-back period starts. So if you don't have a trust and you're thinking about doing it, please give us a call and we'll be happy to talk to you about it.